What I want to talk about is delivering technology-enabled care to what we think of as the new health consumer. Now you notice I didn't say the new healthcare consumer because we actually think the major shift that's happening in our system is we're moving away from health care and we're going to focus increasingly on health. And that's also different from staying healthy. So I'm going to cover some of these ideas as we dialogue and go through this. And Bruce mentioned that I've been fortunate to run 3 different public companies. 2 of them are in the healthcare space, and the last one was a big electronic health record company where we really had a lot of experience trying to understand both patient behavior, physician behavior, and health system behavior. All 3 are different and in many cases conflicting. And the one thing I'd say as you think about electronic health records, understand that electronic health records today, having run one of the largest companies, are really data repositories. They're not yet information systems, and that's really to come. So when we talk about seeing the promise of what's to come, we won't see that today, we won't see that yet in electronic health records. That's the next stage. And the real question is, will that come from the electronic health record companies themselves, or will that come outside from a variety of people who are working on the front end? How do we engage and how do we empower patients? Or the back end, which is how do we get the data, the analytics, the data science to really understand what all this information that we're gathering means. So that's where Watson and 100 other different analytics companies come into place. But let's talk about where we are today to set the stage, and that is we really have 2 different health industries that we have today. So the first one is traditional healthcare. And that's an acute model, and that is you come in, something's wrong with you, and we fix you. And that's whether it's a heart surgery, whether it's a broken arm, that's one traditional model. And as I'll suggest to you, that's part of our challenge, which is you go see the doctor, you go to the hospital, you get fixed, you go home, and you go on with your life. And the other model that has really come up more recently is this idea of health and fitness. And I could use one of the great examples of this is the Fitbit and 100 other devices and things that are going to keep us healthier. And of course the challenge with that is most of the people using those devices aren't actually the ones that we really need to be focused on. Because what's happened in the last 20 years is our success has really challenged us, because traditionally we were able to manage people who were healthy and we were able to manage people who were sick. But what's happened is as the rules changed, we've seen a new category. And that is I'll call them, for lack of a better term, the always sick. And that is people with chronic conditions. And if you look at the one challenge of today and of our future, both in terms of affordability and in terms of care, that is chronic disease. And we've given some examples here, but if you look at the projections, and we'll take diabetes, which is an area that I focus on today, 30 million people with diabetes just in the United States, about 10% of the population. But if we look around the world, in 10 years, China and India will have more people with diabetes than we have people in the United States. China and India will have more people with diabetes than we have people in the United States. I mentioned our rate in the United States, about 10%. If you go to the Middle East, excluding Israel, about 22%. If you go to Mexico, about 17% with diabetes. And then if we look at above the age of 50, 70% of the people with diabetes are multi-chronic, which means they have other diseases as well. Now the challenge with that is that we have to manage chronic diseases in a very different way. And here's why. If you're someone with a chronic disease and you spend 5 hours in front of a physician, that's not the wait time that we just heard our last speaker describe. This is actual face-to-face time. 5 hours in front of a physician. Now, less than 1% of the United States, people in the United States do that. But if you did that, that means that 99.9% of the time you're on your own to manage your chronic disease. So whether it's diabetes, whether it's hyperlipidemia, whether it's any number of issues, essentially what this says is you're on your own to manage your disease. And unfortunately, there are a whole bunch of reasons, we're trying to solve some of them with technology, that today the healthcare system is not accessible to you. So if you say, oh, I've got a problem and I want to go see my doctor, but it's the weekend, good luck trying to get to your doctor on the weekend. Good luck trying to get to your doctor through his reception or her reception on any given day. If you say, I just need to talk to her for just a moment, can you put me through? The chance of that happening is very, very small. The odds in Las Vegas could tell you that's not a good bet. So what is it that we have to do? We have to look at this in a very, very different way going forward in the future. And the last variable here is that consumers have also changed. So in the old days, we were happy to go to a physician's office and spend that 3.5 hours or more. And that's just the way it was. You waited for your doctors. But as a friend of mine who's a physician says, he said, you know what the problem in healthcare is? Patients aren't patient anymore. They used to wait for when I was ready, and they would be there, and they would be happy to see me, and now they complain if I'm late. Can you imagine that? And what's happened is that healthcare, people have started to say, we want the same standards in healthcare that we have for everything else we're doing. And this is this third segment that's really emerging. And where is it coming from? Well, it's coming from the idea that whether it's Facebook, whether it's any number of new services, whether it's Uber, we want what we want when we want it, and we think that's our right. So we think of this space as somewhere between health and fitness and the traditional healthcare system. We like to call it health aware. Why? Because I think what you're seeing is that healthcare fundamentally is becoming an information business. Now I know that seems odd because we have all these people and things and tools and buildings, but when you really think about healthcare, what you want to know is answers about what you should do, about what your condition is, and you want those answers when you want them in your time frame. And then, before you have those answers, you can't really tell anything else. So the biggest part of healthcare, increasingly, is the right diagnosis. It's not the treatment. The treatment will be increasingly commoditized. So if you're an employee for Lowe's, let's say, a great employer, a leader in healthcare innovation, and you need heart surgery, and let's say you're living in Austin, Texas, or you're living in Philadelphia, where do you go to get your heart surgery? Who knows? Raise your hand or just shout it out. Hospital? Well, yes, you go to, I hope you go to a hospital.
Penn.
Penn, no? So anywhere you're a janitor and you work in Austin, Texas, you're the CEO and you're in North Carolina, you all go one place. And that is you go to the Cleveland Clinic. And they made a deal and they've said, Cleveland Clinic, top rated, we're going to make a deal with them, and wherever you are, we're going to give you 2 tickets and you're going to fly there. No more surgery, no more choice. You actually do have a choice. You can do anything you want, except you have to pay for it. If you want them to pay for it, they've decided this is a high quality place, no one will dispute it, and they're going to standardize care in that way. And so that's a very big shift in the way we thought of this before, of saying, how are we going to do that? Now, why'd they do that? Because they figured out from an information perspective that the best place to get treatment and to standardize it is in one place. And they've made that decision. So this is about changing to an information business. And as we look at that, we see 3 different elements. First is consumer empowerment. Second is real-time care, and that's care when you want it, where you want it. And lastly is the network effect, because the care team just got much broader than it was traditionally. The care team used to be your physician and maybe his or her nurse. But today, and for chronic diseases, the care team is whoever's around and whoever has the best information about what you should do. And in most chronic diseases, what you should do doesn't involve surgery. It involves things, behavioral things, that are most impacted by those surrounding you. So let's look at consumer empowerment. Now I wrote an article for Forbes, and it was actually the most hit article of the week, but 60% of the people actually didn't like it. And the article said people don't want to be more engaged with their health care. People don't want to be more engaged with their health care. So a lot of people were upset with me because they thought I was encouraging people not to be engaged with their health care. And it turns out that wasn't the case at all. All I was doing was reporting some surveys that we had done for people with chronic diseases, a lot of people with chronic diseases. And what they said is, we have a chronic disease, the last thing we want to do is spend more time on our chronic disease. We want to spend less time, so why don't you figure out how to make it easier for us? Make it like a pacemaker. You put it in, you don't worry about it anymore, and when it stops, you don't have to worry about it even then. So again, what they were saying was, give us tools that empower us, not that engage us. We don't want more calls. We don't want somebody calling, a health coach calling, saying, how can I be helpful to you today? And when do they call? In the middle of the day, when you're at work, when you're engaged with something else. They said, give us tools that empower us. So they've changed the game. And they've changed the game in another way to say, we know what good service and good technology looks like, and we see it all around us. We see it in good user interface. We see it in responsive service, in not having to wait. And most important, what do you see across all of these names that we all know and love so much? And I say love so much because their net promoter scores are off the charts. What do we see? We see high information content, high user interface content, and ease of use. And we'll talk about all those. Because when you're implementing any kind of healthcare program, across the board, you need four things. First and foremost, it has to be personal. We don't believe that you can bribe or reward people into better health. A little bit of that works, but all the studies are showing that the stayability power of that for long-term behavior change is actually pretty small. In fact, sadly, punishment or pricing, another way of saying that, actually works better than rewards if you want to really change behavior. Make it more expensive, people will do it. Give them rewards, and after a while they say, these rewards, I've got enough of these rewards, I don't need more. But what does work is making it personal. If I call you and say to everybody in this room, you should go for an exam twice a year. Some of you will, some of you will say, I'm busy. But if I call you and say, we have your lab results, and they show that there's a spot here or a spot there, we'd like to see you, you can't get in fast enough. And that's pretty consistent. Why? Because now it became personal. Before it was general. Now we made it personal. Second, how simple can we make it to stay healthy? And in terms of being simple, again, people don't want to do more. Now remember when Google went into health and when Microsoft with Health Vault, they said just enter all your information in and everything will be good. And they didn't succeed. They were failures. Why were they failures? Well, simply because people aren't going to do more until it's too late, until they're already sick. So we have to make this idea of staying healthy very simple. 3, maybe the most important on here is context aware. And that is that what works in a certain context. I'll talk more about this, but let me be very specific. If right now your cell phone rang and someone said, I can be there in 5 minutes to fix your flat tire, you would kind of look at it and you'd say, who gave you my cell phone? Why'd you call me? And it wouldn't be a neutral. You wouldn't say, well, thanks so much for calling. I don't have a flat tire. Most people would be a little bit irritated by it. But if you got that same call, those exact same words, and on your way here, you had a flat tire, you would say things like, perfect timing. Oh, I can't believe it. You'd be so happy. And the one thing you wouldn't ask is, how much does it cost? You'd say, just fix it. That's what context does. And so when we call people and interrupt people in the healthcare system, even trying to help, and we're out of context, we get a negative reaction. And last but not least, it has to be actionable. And one of the things we talk about is not big data, because we hear all this about big data, but rather the power of big data is what it can make small. And that is small recommendations that you can do to improve your health. And that really has to be the focus. So I'll use an example in diabetes. When someone's blood sugar is high, in the system that we have now, and it's cellularly connected, and their blood sugar is high, and they get back a message and it says, drink 2 glasses of water, walk for 15 minutes, and check again in 30 minutes. 82% of the people actually do that. Why do they do it? Well, because it's actionable and it's something they can do. And people want to feel better and they want to be healthier. But they'll only do that in the context of how they live their life. So let's look at real-time care and what that really means in this case. So if we look at testing, there's a number of tests that we've had. So first we have basic tests, a stethoscope. Now most doctors would tell you that with little exception, a stethoscope will tell you that someone across from you is alive. But other than that, there's not a whole lot of diagnostic information that they get from a stethoscope. A temperature will tell you is somebody in good health most of the time, or occasionally do they have something wrong. And then we have a more sophisticated technology, an X-ray, which tells you in a point of time is somebody healthy or unhealthy. But where we're moving, what you see on there is a cellular connected wireless glucometer. What we're starting to be able to tell is over a period of time how your body is functioning. And once we know that, the beauty of that is we know when to intervene, how to intervene, and how we can help you. And that's really this future. Let me give a specific example. So if you looked at Susie and Joe, our traditional metric is called an A1C. Raise your hand if you know what an A1C is. See anybody out there? Okay. So basically an A1C measures the amount of, in simple terms, the amount of blood sugar you have. And in this case, Susie and Joe would both have an A1C of 8. But when you deal with people with diabetes, what you want is a stable blood sugar. And what you see here is that they have a very, very different experience. And yet, if you were a population health manager and you were looking at this, you would say, well, who should I call today? It doesn't seem to matter. Maybe I'll call Susie. And you call Susie, and Susie is not happy because Susie's feeling fine. She says, why did you call? Why did you interrupt me? And really, there's no reason to call Susie. And we have this happening across the country today, which is we have well-meaning people who are trying to manage health without any kind of information. And that's really this difference, that as we move toward real-time care and real information, we're going to be able to pinpoint and target who needs help, when, and how we deliver that help best to keep them healthy. And the beauty of that is they're going to love that, because who doesn't want help when they need it? Now we see this all the time. We see this when we have a question and we go Google it, because at that moment we need help. We see this when we're using Waze or some other technology to find directions, because it tells us, oh, traffic jam ahead, go this way. And we take that for granted, but not so much. We actually have an expectation now that our technology is going to help us in that way. But in healthcare, we don't have anything like that today. And that's really what we see is changing. So let's go a step further and talk about what the future of chronic care disease looks like and what we can move from today where we are, which is no information. So if you have 1,000 people with diabetes that you're managing, today you fundamentally know nothing about them unless they end up in the emergency room. In the near future, and today, for thousands of people who are using connected technology, on any given day you come in and you know who had a tough night last night, who's running high and who's running low. And then the next step is predictive. And that is a fascinating thing about blood sugar, is that for those people who have low blood sugar seizures, and a seizure basically happens, your blood sugar is too low, your body says, I'm running out of energy, and what should I do? Well, I'm going to shut down non-essential systems. So non-essential systems are walking, talking, and that's called a seizure. And by itself, a seizure actually isn't that dangerous if you were laying out in a grassy meadow and somebody else could find you and give you some fruit and things and help you recover, and that's kind of how the body was designed. But a seizure is very dangerous when you're driving a car or doing all the things that we do, operating machinery and the like. And so there's an analysis that was done that says it turns out that a random seizure for someone with diabetes is actually pretty rare, only about 15% of the time. 85% of the time, someone has lots of low blood sugars before they have their seizure. So an average blood sugar might be 100, somebody might run 60 and then 40 and then 30 and then 40 and then 50. And what we can tell is monitoring that. When someone gets to 3 or 4 of those, we say, we know that there's a huge likelihood if you don't change what you're doing right now, you're going to have a seizure. And that predictability is somewhere on the order of 90%. Which means, if you take that out, you start to say, well, we could actually prevent something like 90% of that 85%, so call it 60% of all low blood sugar seizures, which has a dramatic effect on the quality of people's lives, which is why we're in the healthcare business, right? But also on the cost of what those seizures do when people are hospitalized for them or have accidents because of them and the like. So this process of moving from how do we use technology today, how do we manage differently, and then learning about new ways we can use it to actually change the course of what's happening. I'll give you one other interesting example. There's a new enzyme that research has shown before someone has a heart attack, the body releases this enzyme up to 4 hours before you have a heart attack. It's essentially the body's early warning system. It's like a button in your car that goes off before you're going to run out of gas or something. And so the body does that. The problem is we don't have any instrumentation to call somebody up and say, oh, by the way, we see this enzyme, you probably want to head to the ER right now, as opposed to going to lunch. But in the future, we will have that instrumentation. And as we learn more and more about how to understand the body's narrative, how to understand those signals that the body is sending us, we'll be able to predict and prevent many of these issues. And then the last one, which is important in this concept of health aware, is the network effect. And that is, when you have a heart attack or when you need heart surgery, you have to go to a hospital. But when you have a chronic disease, the biggest indicators of how you do with that are the people who surround you in your life. And the more they can know about what's going on in your life, the more they can help you address it. And that's what's happening here. Now, the interesting thing about network effects is they do a few things. One, to the extent that you have a team around you, you always function better. Lots of literature on that. So if you want to accomplish a goal and you tell people around you, you're more likely to accomplish the goal. Flip side of that is if you have a task to do and you have a chronic disease and people understand what they need to do and what you need to do to stay healthy, if they know about it, you're going to be healthier. So those are things we know empirically from research. And then there's some psychological things as well, which are knowing that someone has your back through technology, knowing that if something happens, that you're connected and protected is fundamentally a good thing from a psychological standpoint. And this idea of you're not alone with your chronic disease is very important from a social networking standpoint. But there's a second piece of that as well. So how many people have used Waze before? W-A-Z-E, raise your hand. So Waze is this wonderful technology that it helps you find where to go in directions. And what you put your information in, and it gives you information, and it can tell you the fastest way to get somewhere. What a lot of people don't really understand is when you participate in Waze, you actually become a part of and a contributor to the system. So what does that mean? Well, you become a node on the network, and they are measuring wherever you are, how quickly, how fast you're traveling, and they're inputting that. And they're getting all kinds of feedback, some that you actually can enter. If you see an accident, you can touch a little button on Waze and report it, and lots of people do that. But some that you have no idea that it's happening. And that is, they are measuring things like how fast traffic's moving. But this isn't subjective, well, it feels like things are going pretty quickly. This is actually measuring the speed of your car, where your car is going, how fast your car, how many stops you have, and the like. And the same thing is true if you look at what's happening with chronic diseases. And that is, the more we get people connected with this new connected technology, the more they become not only receivers, but contributors to solving and addressing these diseases, both from an information standpoint and from a care standpoint. So what happens now? Bruce had asked me before this, he talked about why do you come to conferences like this? And so I said, well, one, the information exchange is great. And you've had, the number of speakers and kind of the quality of the speakers here is fantastic. And so you hear all these new ideas. But the other reason you come is because sometimes when you're trying to move an organization, whether it's a small group or whether it's a massive integrated delivery network, it can be exhausting. Sometimes you feel that sense of you're all alone. And the great news is when you come here, you're with a number of like-minded people who understand innovation, who understand the challenges, and you can share the ideas, the techniques, and maybe some of the energy that comes from being with those like-minded people. But it is a challenge in terms of what we have to do. And so what are the challenges that we all face? So the first is just keep doing what you're doing today. And I think the good news in healthcare is we all understand that that is no longer a viable option from a care standpoint, from a cost standpoint, and from a consumer standpoint. And that is, in reverse order, your customers will disappear. You won't get paid for those customers, or you'll get paid in a different way. And last but not least, the care won't be any good because you're not doing what you should be doing. And so this idea of kind of the status quo doesn't work, and doing nothing doesn't work. And so what do we really need to do? Well, more and more, and part of the reason I left a large company, I was interviewed, and I went from my last company with 8,000 employees and a few $1 billion in revenue to doing a startup with 2 people, me and my assistant, when we started it. And somebody said, how does that feel? And I said, it feels scary as hell. Standing in that room and with no one. But part of the reason to do that is because I think that innovation that can be brought, and we're headquartered in Silicon Valley, and what I see there is fantastic. The challenge is, how do we get those ideas and how do we get this technology out there to the organizations that can deploy it en masse? And I think that's the real challenge here. And I'll say a word, I like this quote because it says you can't outwit fate by trying to stand on the sidelines and placing little side bets about the outcome of life. And here's another one of our challenges today. I was talking with one of our speakers earlier, and he was talking about his organization, one of the most renowned organizations, had thousands of pilots going on. And one of my partners said that, he was referring to a different organization. He said they have more pilots than United Airlines does. And the issue is we need to now jump in and make some bets and say we have to go at this aggressively. Because going at the pace we're going, the reality is we know how personal healthcare is, but we also know that not doing healthcare right means people get impacted. And there's thousands of people across the board who die every year because we didn't get to them in the right way fast enough. And we can make that difference here. So this is not just about playing, and it's not just about piloting. It really is about making a commitment to the future of this technology.